Hello everyone, welcome you all in the course of mental health and well-being. In this module, lecture 1, we will discuss about the understanding of mental health in adolescent and early adulthood. Our main objective and outcome from this study will be the brief about the adolescent development and then the physical, cognitive, emotional challenges and the development in early adulthood, then major determinants and challenges in those phases, and then what adolescent can do and what their parents can do. So let us start with the slides. So let us start with brief about adolescent and developmental changes. So as we know that adolescent age range is from 12 to 18 years of age, and the period of this transition between childhood and adulthood. So it is a very crucial period in terms of developmental. It presents a new and unique challenges, a rapid and significant physical, cognitive and social growth. So if there is a late or early puberty, this can make adolescents sometimes difficult. Like they can compare themselves with other age group children and can have negative sense of self-worth, can have low self-esteem and even some kind of poor sense of self-image. The emotional center in the teenagers' brain are also maturing at this point of time, and need for the increased stimulation bring it a significant threat to the adolescent health and well-being. So what happens? There is high novelty seeking and sensation seeking at this point of time. So they can have get involved into some kind of activities that can be harmful for them. So in their push towards the independence, adolescents begin journey into autonomy, and that is usually not completed until sometimes during the adulthood. And the parents become progressively less important and in regulating their adolescent behavior as a transition to the self-regulation, and greater independence evolved during this period. So what happens here? The adolescent become individuated from the family. We call it as a second individuation phase, where adolescent becomes autonomous. He or she start taking his or her own responsibility to establish himself or herself in the social group. They form different kind of strategies to deal with the situations. So moving on to the major physical and cognitive and psychosocial development in early adult phase, that is around the 20 to 40 years of age. And during adulthood, the developmental changes continues, but the change is very subtle and unnoticeable compared to other development like adolescent phase. Our physical and cognitive skill expands while psychosocial concern change more noticeably to include independence household, self-supporting work, intimate partnership and parenthood. So what we can see here, the psychosocial factors become much more important in this adulthood phase than in the adolescent phase. And the same way, the responsibility and other social concern become the prominent factor here. Now talking about the health in the early adulthood. So most young adults are generally healthy at this point of time. Even if disease is there, the person may feel fine because the disease is likely to be in early stage and possibly asymptomatic or undiagnosed. So it is because of the immune system that is working properly at that point of time. And when the many losses in the functioning that people suffer as they age may not be a result from the normal aging, but it can be a resultant of the pathological aging caused by illness, abnormality, genetic factors or exposure to unhealthy environment. The health compromising behaviors that lead to illness, like including smoking, poor eating habit, physical inactivity, that can also lead to the pathological aging. So here we can differentiate that how pathological aging can affect the early adults. So talking about the stress in early adulthood. So as this is the achieving stage, the demand of establishing career, learn job, organization rules, norms and fit to the chosen occupation increases the competence and starting a family likely to bring a new level of stress at this point. Many young adults ignores or deny this stress, and they do other health related issues, relying on health compromising behaviors uh, to make themselves feel better, like they use tobacco, alcohol, drugs, and that are used to reduce the tension, anxiety, and to improve mood. And this prolonged use of these kind of maladaptive behavior to deal with the stress is leading them to the exhaustion phase, and this exhaustion phase can result into some sort of illness. So for your reference, you can go and check the Hans-Selye's GAS model, General Adaptation Syndrome model, in which there is a alarming phase and then resistance to that stress, and after all then leading to the exhaustion phase. So in this slide we will talk about the timing of the event, that is social clock, with a case example. So it starts like Tanya began her medical degree with when she was 32 years of old and married and mother of 2 young children. 12 years later, she feels she is behind in her career as a doctor because of her off-time education or as a matured age student. What is the origin of her sense of what is appropriate at a given time? While some aspects of her life are biologically and socially on time, such as being married and parenting, Tanya may compare her career progression with others in the social group. Her age peer classmates are in the achieving stage, and Tanya feels professionally alone. Her level of career development places her in the achieving stage, while her family's maturity places her in the responsible stage. And as a result, she feels off time. So the social clock tells if we are on time in the following age appropriate timetable of our social group. These on time parents provide support for each other in the transition parenthood. And off time does not necessarily means that it has always a negative outcome, but it oftentimes create a discomfort and increase perceived isolation from one's peer. So this is how the social clock can affect the adult lives. Now coming to the early adulthood crisis, and the first is forming intimate relationship. So here we will talk about the intimacy versus isolation. According to Erik Erikson theory of psychosocial development, the primary task of early adulthood is to form an intimate relationship. Difficulty in achieving intimacy can lead to the feeling of isolation, loneliness, depression, and other form of illness or issues. Then fear of commitment and intimacy. This is also a very important factor in forming a intimate relationship. Some young adults may struggle with a fear of commitment, emotional vulnerability, and making it difficult to form a long-lasting, meaningful relationship. The third is balancing independence and intimacy. Some individual may feel losing their sense of self in a relationship, while other may struggle to open up emotionally. Then dating concern. Young adults often experience anxieties related to the dating, such as fear of rejection, uncertainty about compatibility, pressure to impress, and other communication challenges are there. The second is navigating social dynamics. So there are a different transition phase in adulthood. So like changing friend, as a young adult transition from high school to college or workforce, the close friendship may drift apart due to differing life paths and priorities. Then family dynamics, leaving home, establishing independence can lead to shift in the family dynamics. Young adult may experience power struggle with parents or grapple with the changing roles and expectation within the family. Then social isolation and loneliness. The combination of changing social circle, increased mobility, and greater reliance on the online interaction can contribute to the feeling of loneliness and isolation among young adulthood. Then social comparison is other. The social media often present idealized version of others' life, leading to social comparison and feeling of inadequacy and or low self-esteem, which can negatively impact the interpersonal relationship. So all these factors are very important to understand in terms of the relationship or the is this kind of social relation dynamics. Then other is developing interpersonal skills. This is very important factor which oftentimes lead to the difficulty in the adult lives. Like in this, it involves the communication skills. Like effective communication is crucial for healthy relationship. Young adult may still be developing and in their ability to express their thought and feeling clearly, listen actively and resolve the conflicts constructively. Then boundary setting, establishing and maintaining healthy boundary in relationship. Young adult may struggle with asserting their need and limit their interaction with others. Then conflict resolution. Disagreement and conflict are inevitable and in any relationship. So developing a skill to navigate these situations and constructively compromising and find acceptable solutions, a key challenge in this early adulthood is important. Then empathy and perspective taking. Understanding and sharing the feeling of others is vital for building this strong social connection. And young adults are continually refining their capacity for empathy and seeing situation from different perspective. So all these domains are related to the communication and how to maintain the boundary, set the boundary and put a clear communication between in the social relation or interpersonal relation. Then there are some external factors such as social media impact and career uncertainty and financial stress. So while social media can facilitate connection, it can also lead to the misunderstanding and jealous and a blurring of boundaries in a relationship. So this nowadays this is a very important factor in disturbing the interpersonal relationship. So social media can form any kind of misunderstanding. People can have a very small part of the information and get into the judgment or get into the biasness. Then career uncertainty and financial stress. The pressure of establishing career, achieving financial stability can create a stress and that spills over the interpersonal relationship, affecting communication and overall well-being. So financial stress and uncertainty in this age group is also very common. Then cultural and societal expectations. Young adult may feel pressure to conform certain rules and norms in the society, or even when there is a transition, when they come to the different institute or away from their home in some different state where there is cultural difference. So to adjust themselves in that situation is a very challenging task for them. It can be a workplace, it can be a educational place, or it can be any other sort of domain of life. So here this created anxiety and impact their interpersonal interaction. So successfully navigating all these challenges that we have discussed in interpersonal domain is very crucial, and overall well-being for early adults, as this lays the foundation for their adult lives, like developing a strong communication, practicing empathy, setting healthy boundaries and seeking support when needed are essential for positive and fulfilling relationship during this developmental stage. So now talking about a very important psychodynamic factor, that is a development of adaptive mechanism. So here we can differentiate like how the adolescent and early adult differ in terms of dealing with anxiety. So there is an unconscious mechanism of defense to deal or ward off anxiety that is coming out by any thought, by any emotion or any situation. So adolescent, they mostly use denial, projection, regression, displacement and acting out as a major defense to deal with these kind of anxiety. And the adult, they uses mature kind of defense mechanism and like sublimation, humor, altruism, suppression and intellectualization. So this is to show whether how when the adolescent changes into the adult life or get into the early adult phase. So how the change in the adaptive mechanism is also taking place in a similar way. Next, talking about the mental health determinants during adolescent and early adulthood phase. So these are some factors like we already have discussed in detail, but these are like transitional stress, social relational factor, educational and occupational pressure, identity exploration, financial strain, substance use, and access to the mental health services. So these are the determinants that are important for in terms of mental health. So talking about the common mental health issues that adolescent and early adult can face. So first is the anxiety disorder when talking about the adolescent and early adult. Another is the mood disorder. The mood disorder, specifically depression and bipolar disorder. So depression is very commonly found at any age range population, but here it can affect the early adult and due to many other factors that are responsible for it. Then substance use disorder, like at this point of time, especially at the adolescent and early adult phase, as I talked that adolescent there is high novelty seeking and high sensation seeking. So they try different new things, new experiences. So at this point of time, they can also get into some kind of substance abuse or they can have substance use like alcohol. They can also use some kind of drugs. They can also use some cannabinoid substance. So these are the substance mostly that can be as a part of mental health issues. Then eating disorder, if there is any kind of body image issue or some sort of self image related issue in their developmental phase from the adolescent to the adulthood, then these eating disorder can happen or can be a cause of a mental health issues in the adolescent or early adult. And these disorders are often linked to the body image concern and societal pressure. Then another is the personality disorders. So certain personality disorder, most commonly like borderline personality disorder, that is very commonly can be found during this early adulthood phase. And then the psychotic disorders like schizophrenia, and it has onset in the early adult, between the adolescent and early adulthood phase. So this can also be a challenge for the early adult. So early detection and treatment is very important, and it is crucial to address the need of adolescent and early adult with mental health condition, avoiding institutionalization and over medicalization, prioritizing non-pharmacological approach. So I mean to say that the primary cases can be dealt with non-pharmacological way of management. Next is how parents can support a healthy adolescent development. So the parents can foster the independence and autonomy, like encouraging the decision making, allowing student to make their own choice even if you disagree. This fosters the self reliance and the ability to learn from the mistakes. Then offering guidance and advice, but avoid taking over. So these kind of autonomy and independency can help the adolescent in their developmental stage. Then second is support exploration. So at this point of time, they have the exploration capacity. They try to explore many new things. So encouraging exploration of different paths, interest and relationship, this can help them to learn new things and better things, and provide a safe space for them to experiment and discover their identity. This is also a very important part of development. Then promote responsibility, support them in managing their own finance, schedule and responsibilities. This helps them to develop the essential life skills that is needed in this phase of life. Second is providing emotional support. Maintain open communication, like create a safe and non-judgmental environment for open and honest conversation. Active listening is a crucial. Then offer unconditional support. Let them know you are there for them regardless of their choice or challenges. Validate their feeling and the experiences. Then help with stress management. Offer support in navigating the stress of early adulthood, like such as career pressure, relationship issues, and financial concerns. Help them to learn a healthy coping mechanism. So this is very important in terms of providing support. The parent can teach them better coping strategies, offer unconditional support, and maintain the open communication. Then third is supporting healthy habit. The encouraging physical well-being is important, like promote healthy eating, regular exercise, and adequate sleep. Like it can be led by the examples. And support mental health, like encourage them to seek the professional help if they are struggling with mental health issues, and help them to understand that mental health is just as important as physical health. So there is a need to reduce the stigma that is ongoing in the society and in also the interpersonal area domain. Promote healthy relationship, like help them to understand what healthy relationship looks like, and support them to learn to navigate a romantic and platonic relationship rather than they try and get into some maladaptive form of activities. Then the fourth point is shifting the parental role, that is transition from authority to mentor. So this is also very important when we talk about the parenting skills. A parent must know how to shift themselves from as a parent to the mentor and move away from the controlling role towards the supportive and advisory role. Offer guidance and wisdom based on your experiences. This will help the children, the adolescent, the early adult to learn from your experiences. Respect boundaries. Recognize that your young adult need space and privacy. Respect their boundaries and avoid being intrusive. This will help them to learn how to create a space and maintain a boundary in a relationship. Then focus on the relationship, like prioritize maintaining positive and supportive relationship. Enjoy spending time together and celebrate their achievement. So all these things parents need to shift themselves as from authority to mentorship. Then what adolescent and early adult can do during this time? So if there is role of there is responsibility of parent, then there is also responsibility for the adolescent and early adult. So the first thing is they avoid looking their parent as the enemy and try to understand their parents as a human being with their own insecurities, needs and feelings. Listen to their parent with open mind, try to see the situation from their point of view and share the feeling with the parents so that they can understand you better. Live up to their responsibilities at homes and in a school. Bolster their criticism of family, school and government with suggestion of practical improvement. So all these points are very important when we say that what adolescent can do or early adult can do to maintain a healthy relationship in terms of interpersonal relation. Then another important factor that involves each and every human individual in this part of the management, that is the promotion and prevention. So mental health promotion and prevention intervention aim to strengthen an individual's capacity to regulate emotion, enhance alternative to risk-taking behavior, build resilience for managing difficult situations and adversity, and promote supportive environment and social network. And these programs requires a multi-level approach with a varied delivery platforms, example digital media, health or social care setting, school or the community, and varied strategies to reach adolescent, particularly the most vulnerable one. The few examples of the initiative taken by Government of India, like the first is NMHP, that is National Mental Health Program, that was launched in 1982 and aimed to provide a mental health care for all, integrate mental health knowledge into the general health care. Then another is district mental health program. Like it was also introduced in 1996 under the NMHP, and DMHP operates at a district level and provide counseling, outpatient services, suicide prevention program and awareness initiative. Then third is manpower developmental schemes. It is part of NMHP since 2009, and these schemes focus on increasing numbers of mental health professionals through establishment and upgrading mental health departments in the government medical colleges and other institutions. Then the important one, and this is running very efficiently at this point of time, that is the national tele-mental health program, that is Telemanas, and that was launched in October 2022, and for the mental health support via national toll-free helpline number, that is 14416, and that is available in 20 Indian languages. Then school mental health screening. This is a screening to screen any student or children that are having primary symptoms or having the problem of mental health issues during their early phases of life. Then other is Rashtriya Kishore Swasth. This program by Ministry of Health and Family Welfare. This focus on the holistic development of adolescent between 10 to 19 year of age. And then a school health and wellness program that was implemented under Ayushman Bharat, and this program trains teachers health and wellness as a health and wellness ambassador. Then adolescent friendly health clinics that was established under the Rashtriya Kishore Swasth Karyakram, and these clinics provide a counseling and other services relevant to the adolescent mental health. So these are the references that you can go through to get these topics in details. Thank you.